to tell you about this lovely, amazing woman. This is Amy Campbell. As you just learned, she's a Master of Public Science.
You'll introduce it in a second.
She works with me at the Office of Substance Use and Mental Health. She received her bachelor's degree in nursing from the College of
St. Scholastica.
And she has a master's degree in public health sciences, public science health, from the University of Eastern Finland. Wow, she's international. In her current position, she oversees the peer support program across the lifespan in the state of Utah. So this is exciting, a new position that we just created for her. Amy is a recovery ally and has been working with the recovery community since 2019. She's very passionate about harm reduction and providing non-judgmental support, education, and access to resources to help treat people with respect and dignity. Outside of work, Amy is a multi-passionate foodie, traveler who enjoys climbing and skiing. Welcome to Amy.
Yeah. Thank you. Yeah, just to give a little bit more introduction to myself as well before we get into it, also because Heather's supposed to be here at some point. Yeah, so how I ended up kind of working in this field was that I took a AmeriCorps position with a recovery community organization in my hometown of Duluth, Minnesota. And that was my first time I was introduced to peer support, but mental health had always been my passion. That's what I focused like my master's thesis on, internships, and my own family has a lot of mental health and some substance use history. I unfortunately lost both my brother and my dad to suicide, so that was definitely like my biggest incentive and motivation for mental health. And then once I kind of got introduced to peer support, that was my first introduction to substance use, and then I just really ended up like finding it so interesting and fascinating. And then I ended up using that experience, got a job at Utah State University. That's what brought me here to Utah, and now I work for the Office of Substance and Mental Health. Okay, so this is our agenda for today. We're gonna learn who is the team at DHHS. And so you can put a face to the name when you get all these emails from everyone. We're gonna go over the new online application system. We're gonna talk about how to verify a certification. And then recertification in CEUs, website updates, specialty trainings, and then like some frequently asked questions, and then you can also ask them questions. Kind of my incentive or like kind of hope of doing this presentation is that I've known from my previous job being a trainer at USU is that there's definitely a lot of confusion around just the process of applications, how to recertify. So my point to this presentation is also just to be able to provide some clarity and like clear communication, so you can also bring that back to your own communities when there are a lot of questions and people don't quite understand what they're supposed to do to recertify and things like that. You're welcome to stop and interrupt me and ask questions, but otherwise there will be time at the end to ask questions. Okay, so here is our team at DHHS. I've been told multiple times that I'm the replacement for Pam, and let me clarify, I am not the replacement for Pam Bennett. But Pam Bennett did get a promotion this past year. She's now the assistant director of the office. So because she moved up into a different position, there's kind of this movement of like the teams essentially. So what was created after this kind of the new hire of myself and stuff was that we now have a children and adult mental health services team. And Leah Colburn is kind of overseeing that, so she's my supervisor. And she's the one who also used to do all the family peer support specialist stuff for the state. But now that's passed off to me as the new hire. So I'm overseeing like all of peer support. So I'm overseeing the family and adult peer support. So I'm the one that's doing all the things of peer support. But then you have Heather, who you should all know, and she's right there.
Hello, Heather.
So Heather's been doing this for 5 years?
In this role, yes.
In this role. So she's definitely the name that you probably know the best, but she is still your go-to when it comes to adult CPSS peer support. And then we have Carmen Lloyd, who's also helping up front if you do want to meet her. But she's been doing this longer than Heather, but she's also the main one that's answering all the emails. So when you do see a Carmen signed at the email, this is who is answering the email. She's technically a different team than us, but she helps us a lot with peer support. And she sends out certifications, and does a lot of the email stuff, and will help with applications as well.
Are you over the forensic peer support too?
So that's Heather's.
Okay. Oh.
Yeah. So if you do have any questions about that specifically, you can ask it at the end. And if not, Heather's going to do a panel discussion for the next breakout session. So definitely go to that. Okay, this is also just like the org chart, just because I'm, just giving you all the information about DHHS. So there's Heather and I, way down the bottom. So as you can see, the Office of Substance Use Mental Health has around like 60 employees, so it's pretty large, but our little peer support team is right there. So we're the ones doing all the things. Previously it was pretty much Heather kind of doing everything, so that's also kind of one of the reasons why they hired me, is just to give a little bit more support, and also just to streamline some of the services, which we will get to in this presentation. Okay, so the new big change that's coming up is that we are moving all the applications to online. The Family Peer Support Specialist application is already live, so we're already using the new online system. The paper application is currently on our website, but it will be coming off in about a month. But then hopefully this fall, we're going to transition the Certified Peer Support Specialist to completely online. So that's going to be a big change. We're going to go over it in a second of what it looks like. Kind of our hope behind this, we've tried a few different platforms throughout the years with not a lot of success. But we've been using this one now for case management and a lot of other certifications. We've already been using it. It's a great way to store all of our information and data and be able to run reports. So hopefully this will also make things a little bit easier on DHHS and keep things a little more organized and streamlined. So paper applications, we're gonna have a pretty hard stop. So once we do implement this, which I will also be blasting out emails and things, we are gonna have a hard stop to paper applications, and we'll let people know when they send it in that they have to apply online. We do have an instructions document that is already posted on our website, and so there will be options for telling people how to actually use the online system. And it's the same with recertification. That will also be in the online system too. And so it'll be very similar to the actual application, but you'll end up creating a login, and that's how you will recertify. But we'll go into this in a little more detail. Any questions so far? Okay, so here's our images of the applications. This is what it's going to look like when you log on. So it seems like a very long title, but the reason is because this is DHHS's way of organizing all the different online applications. So it has substance use mental health because that's our office. But then you'll see that it says peer support specialist and dual training application. So it will be it'll end up being one go, like you can't save it. So you do have to have everything prepared before you submit your application. But it's a pretty standard walkthrough of an online application. And then you'll see like there's red asterisks that tell you whether you're required to answer it or not. The CPSS application, and I'll go into the dual training at the end too if you have any questions about that. So this is the Certified Peer Support Specialist application, so it looks pretty similar. So this one you do have to upload documents, and so we'll have to be in a PDF format. It will say on the application. Any questions so far about online application? Okay, so a lot of people have been emailing us and asking, how do I verify this person's certification? And they'll usually give us a name, and then we just look it up in our database. But the other plus side of this online application system is that you can actually go online and verify a certification. CPSS should all be updated and in here. So if you do happen to find a name as you're searching for people or yourself, and if you don't find it, just send us an email and we'll make sure that we get that updated. But especially for family peer support specialists, we might be missing some people. So if you ever happen to see a name that doesn't pop up, please let us know. And I'll show you online also how to do this. So we're gonna use Heather as an example. So under the facility name, you're gonna search by last name and then first name. And look, there's Heather. So this is what it's gonna look like when you open it up. So you're gonna see the peer support specialist name up here, and then that's their number. So you can also look it up yourself if you wanna know your own certification number. It's that kind of, 8-digit code starting with an F. And then below, this is where you're gonna see this license type. So that's where you're gonna be able to tell whether they're a family peer support specialist or a certified peer support specialist or even a case manager. You can also look up case management in the same system. And then you're also gonna be able to see the status. It says regulated. That means that it's active, it's current. And then you'll also be able to see when they were initially trained and certified, and then you'll also get to see the expiration date. And then, I'm not sure if anything will ever pop up over on the other side for the non-compliant stuff, but that's essentially how you will verify a certification. To go over this one more time, we have our test example. So that's where you'll see the certification number that starts with an F. You'll see what sort of license type they have, the date that they originally were certified, and the date that it expires. So this is also a great way for yourself to look it up to see when you have to recertify. So one other thing to say about this system is that you'll see the perfect example was that when I searched up Heather, there's two different names that popped up. So we do have the family peer support and the adult peer support separated. So for example, the first one that I showed you was Heather's family peer support certification. If we go under a second one, you'll see that it says peer support certification or peer support specialist. So they are separated, and that's why you'll see two different names listed below there. You might even have the chance of seeing three names because someone might be FPSS, CPSS, and then also case management. So they are separated, so you'll see, that's why you'll see multiple names listed. Okay, so recertification. We've had a lot of confusion about recertification in the last couple of years. And definitely recently, a lot of people have missed their recertification, and unfortunately they've had to retake the training. So for both CPSS and FPSS, we do require you to recertify every 2 years. And so we did change this in the last year, 2 years, where we're now requiring everyone to recertify on even years. So that means that for CPSS, you're gonna have to recertify on September 30th of either 2024 or 2026. So it's always gonna be on the even years. And so that's why it's been a little confusing because since we've been changing that, some people had kind of like 1 year, some people had 3, just to be able to get everyone on the same track. But it's going to be even years. And FPSS is going to be due on June 30th of even years. We separated those dates just so that we can have a little bit of time in between. We do give we're a little flexible. We understand that, life comes up. Sometimes you forget, life gets really busy. We will give a grace period of 3 to 6 months, roughly. But if it's been longer than 6 months, we will make people retake the training, which is definitely not fun because it is a very long training, but you get to touch up on your skills. But yeah, so we are kind enough that we understand that life comes up, so we will give you that grace period, but please try to remember that it's every 2 years on even years, and September 30th for CPSS and or June 30th for FPSS. Yeah.
How early? How much earlier?
3 months. You can recertify 3 months early.
Okay.
Yeah. Because I think we did have someone recently send in their recertification. It was like 6 months early, and we were like, okay. Here we go. And then Heather and I were talking about it. We were like,
Hey, my coworker
Real life
certified on the same day. His got accepted and mine didn't.
Yeah.
That's
So
fine. I just need to know. I just need to have 3
yeah, so
months.
we will accept it 3 months early, and we will accept it 6 months late. But after that, it's a hard no. Or before that's a hard no. So you must also submit a recertification application. Currently it is a paper application that's on our website. But like I said, in the future we will be using UCLAP, which is the online application system. We'll be using that to also recertify. And with recertification, it is required that you complete 20 hours of CEUs, and we'll go into more detail in a slide. And so you don't have to submit your CEUs with your recertification application. It is a little bit more of a trust system. However, we will randomly audit certification. So keep records of any sort of CEUs that you have, because you might have to submit that to us to prove that you completed your CEUs. Okay, so now we'll talk a little bit more about CEUs. Okay, so here's our breakdown of CEUs. So in that 24-month or 2-year period, you have to complete 20 hours. And so we want you to complete 6 hours in peer support services. And that's really kind of anything that has to do with the core competencies of peer support. So if you look up the core competencies and whatever training you're taking and it relates to one of the core competencies, we will accept that as peer support services. For example, attending this, you get 1 hour for peer support services.
Cool.
The other one is 2 hours in ethics. So that can be anything from like boundaries, HIPAA, really anything that has to do with ethics. 1 hour in suicide prevention. I feel like that one's fairly explanatory. And then the last one is 11 hours in general health. And so general health is a broad category. It's really anything that has to do with mental health, substance use disorders, like physical health, social determinants of health. This one we definitely give a little more leeway just because, right, we're humans. There's a really wide aspect of what general health means. But once again, just kind of keep in mind the core competencies of peer support, and that's what we'll kind of approve or judge CEUs on. All right, so where can you find CEUs? Definitely the best way is at conferences, like now. Usually you can get quite a few CEUs at conferences just because it's multiple days of a bunch of different presentations. And so if there's any sort of conference that offers like a CME or like a social work credit, we'll definitely always accept those as well. There's not really like a specific peer support CEU, but anything that has to do with like medical or social work, we'll accept those. Another really good option is webinars. There's a lot of really free resources, and it could be recorded or it could be a live webinar. So that definitely has a lot of options.
Right.
And then any sort of like workshops, seminars, presentations. So like if you have, we won't necessarily accept ones that are required for your job. So a good example of that would be CPR. If that's something that your job is requiring, we're not going to accept that. But if it is like a special presentation or seminar that your job has brought in for like a specific group, then we would probably accept that because it was like kind of the special occasion and special speaker. But anything that's required for you to have your job, like CPR, we won't accept that. Because like the point of CEU is that we want you to continue learning and continue growing and just like keeping up to date on your knowledge. And as this field progresses really fast, so that's the purpose behind CEUs. So you can use the same CEUs for CPSS and FPSS and even case management, as long as they're meeting any sort of requirements for those certifications. Like for peer support, it's mostly focused on those core competencies. So you don't have to have, if you have both, if you're duly certified, you don't have to have 40 hours of CEUs. You can just have 20. And then definitely keep a copy of your CEUs. Like I said, you might be audited. I have a slide coming up on this CEU tracker. But this is what we have on our website as an example. And so you won't always get a certification of attendance or participation. But a lot of times you will if it explicitly says that they're offering CEUs. Usually you'll get like some sort of a downloaded certificate after. So keep a hold of that for your records. Make a folder on your computer that says CEUs or personal education, whatever you want to call it. And then the other option too is that if you don't get one of those certificates at the end, you can record it on something like this. So you have the date, the course name, the instructor or agency that posted it, the course title, any sort of objectives, and then how many hours it was. And usually for a CEU, it's like 1 hour of participation equals 1 CEU. So it's equal. And then over here we just have our like checkbox of the different categories that you see there. So this is one example that you can keep track. Whatever method personally works good for you, do that. Yeah, so we do just want you to keep a copy of it in case we do ask for a proof of your CEUs.
So I know on that I asked for the instructor and stuff, so my question when I was filling mine out was if like the conference from last year, it just says the CEUs on the bottom, but it does not have instructors, and I like went to go like look for past people that would be, are you guys gonna need that, us to dig that deep and have the instructor reach like this, like suicide prevention, or like, do you want us to have the instructor's information?
So it's very helpful, especially if you get audited and you're required to keep all your certificates or your tracking sheets for 3 years. But it helps us if we want to research it or if we need to research it. Depending on the conference, if you need help trying to track some of that down, reach out to me. Sometimes I can track some of that down, but not all of it. So.
But I just thought it'd be beneficial if I left here,
Yeah,
went
yeah.
straight.
The
and
more
put this into
information that you have, the better off you're gonna be.
But if all you have is the name of the conference or the thing that you presented, then that's better than nothing.
Yeah.
Yeah.
So Amy, can I just say really quick, we actually at USU, we added a line here for the website because there are approved websites that you can get CEUs from, and it doesn't necessarily always have like an instructor or whatever. So there were some supervisors who were asking us about that. And so we have, if you want an updated one that has like a line or a column for the website, if you're doing one online, just email me and let me know and I can send it to you. Because that is helpful too for the ones that are online.
That's good to know. Because that's the next thing I'm about to go into is that we've had a lot of requests to update this. And so that's what we're currently working on. The updated one is not on the website yet because it's still being reviewed. So if you all have any feedback on what you want on this, please let us know. But one big thing that we were asked was to make it fillable. So if you're using it in Word or a PDF, that you can fill it in. So it is going to be fillable now. And then this front side is going to have more information, especially pertaining to these different categories. So there's a little bit different information on the front, and like it gives instructions on how to record them, things like that. So those are kind of the updates that are coming for the CEU tracker. So if there's anything else that you want specifically on this, please let me know because we haven't officially finished it or posted it yet. We're still working on this one. Okay, so now we're kind of going into website updates. So as I just said, we are working on the new CEU tracking sheet. Like I said, it's still being reviewed by our website team, so it's not officially live yet. But I did also create a how to apply for both CPSS and FPSS pertaining to the new online application. There is an instructions document to verify a certification. That's what we've just gone over. So there is a document that gives the link to go to the UCLOC website and also tells you what to look for, like such as like their certification number, things like that. On our website, we also have the training calendar. So if you're ever curious as to when an upcoming training is, it is on there. That's specific to CPSS and FPSS. And then some of the things that Heather and I are working on currently is that we are going to be working on some peer support introduction videos, just like a 3 to 5 minute video on like what peer support is, where they can work, things like that. So if people are like interested in the training, they want to know a little bit more, there's like a little brief video. So it's a current project we're working on. And then we also, I'm going to touch base in this towards the end of the presentation, but we are renewing our contracts with our training agencies. So I am going to have a new descriptions on the website because you'll notice that some have like 2 sentences while some have like paragraphs. So hopefully we're going to give a little bit more thorough description of the different trainings and the different agencies so that people can have a better idea of what one might be a better fit for them. And then I'm also just going to I'm planning to reorganize the website to make it a little bit more readable and flow a little bit better. It's going to look more similar to the case management website because right now it's a little hard to read and a little hard to find everything. So it is going to be restructured. But at the bottom here, this is mostly what I really want to restructure because it just gets kind of messy to find the documents. But these are our new documents that I was mentioning. For example, how to apply to CPSS. So it has the link to the application, things like that. So all of these documents are new, and then we're still slowly but surely updating the website. If anyone has any feedback, please tell me at the end, because I will happily hear you out. Okay, yeah, so those are just some of the updates to the website. Yeah.
So one on there, the bottom was in Spanish. Are the other forms and things being worked on right now?
They're not in Spanish yet. We do have a few fluent Spanish speakers, so yes, that will be worked on. It'll slowly but surely come because they're not on our team, so it's not really priority for them, but yeah, we will hopefully have everything also in Spanish. These are just the updates that I've done since I've started, but yes. Okay, so to go into a little more detail about specifically the Certified Peer Support Specialist training, so to kind of give you a little bit more information on kind of how the process works at DHHS, so we do have, we have current contracts that are all expiring in like 6 days, and so we're updating those. And so what we end up doing is that we basically put out like a request for a proposal essentially, and so that different agencies can submit a proposal to become a training agency. And so when they submit that proposal, we have requirements that we ask of them. They send us like a big packet, including their curriculum and their manual and things like that. And then there's a committee at DHHS that ends up reviewing all of their documents and their curriculum, and we score it. And then it depends whether they pass or not, and that's whether they are approved to be a contractor and approved to be on our approved vendor list is what we call it. So that's ultimately how agencies become training agencies. And so part of that is, right, we have the power, more or less, to request specific things on this proposal. And so if you didn't know, SAMHSA did recently release the National Model Standards for Peer Support. It's a pretty large document, but that was just published in the past year. And so it gives a lot of different details of kind of just the standards of what peer support should look like across the state. And there is a section that does talk about training specifically. And so they talk about like the core curriculum, the core competencies that should be in a peer support training. So in this new round of contracts, since we have this new chance to, change and ask our trainers to, add things to their curriculum, these are some of the things that we wrote into our scope of work that we expect the trainers to train on. And so these are new additions compared to the last time that we had this contracting process. So for example, harm reduction. So we're now requiring all of the different training agencies to have harm reduction in their curriculum. We're also requiring everyone to have a history of the recovery movement. So that includes mental health, substance use, and family peer support. Additionally, computer and digital health literacy, so such as virtual peer support. We're asking the training agencies to have that in their curriculums. This is also a new core content area. Advocacy, so both for like self and system. We're also asking them to have curriculum on like self-care and wellness, especially being in this supportive role. And then trauma-informed care approaches, and then community resources. So I'm pretty sure I hit on all the new ones that we asked for them to change their curriculum and adapt. So this is definitely, for example, if in the scoring process, if we don't see that in their curriculum before we actually do contract with them, we ask them to add this. If they pass the scoring, but maybe they didn't quite have one of these content aspects, we will ask them to update their curriculum. Any questions about this process? Okay, I just want to give you a little more insight into how people become trainers. Okay, so we have some specialty trainings, and we are kind of moving from the term like enhancement training to specialty training. And so there is a brand new one. We just had our very first training in March, the forensic or justice peer support training. And so Heather, the next breakout session, Heather will have a panel discussion on that. If you would like to learn more about it, go to the next breakout session. And so Heather, do you just want to give like a quick 30-second little snippet of what it is in case they don't go to the other one?
Yeah, so just gonna go over kind of the history of the forensic justice peer support, some successes across the state that we've had with that. I'm hoping that it works, but we're gonna actually have 4 individuals that are currently incarcerated that are currently have now become peer support specialists. So we're hoping that it works, but yeah, so that will be the panel, and then the other panel will be those with the successes that we've had so far in the state.
Yeah, so definitely, yeah, very, very cool. So definitely go to that. Forensic peer support is essentially people who have like a criminal justice background or history. That's what the purpose of this specific training is, and with the intention of like working with people who have criminal justice involved.
There will be a fun little raffle.
Sure.
Yes. Let her bribe you.
No, I'm just kidding.
There is a round. What are we winning? What are we winning?
I don't know, what do we do? What can you win, Heather, at your thing?
Tell you.
Okay. Well, that's the incentive. That's what you're gonna get us there. So the next two have been kind of classic ones. They've been available for a couple of years. It's integrated wellness and transition aged youth. These, especially if you took participated in USU and/or USARA's internship program, you're required to take these. We'll still be offering them at least for the next year or two. And then the other option is that Optum does have an 8-hour CPSS refresher course. They don't offer it very often, but they do every once in a while. So if you are feeling like you need to kind of touch up on your skills, or just kind of feel like just curious to have a little refresher course, they do have a 1-day refresher course, so they offer every once in a while. And if you are interested in it, you can always email us, because if we have people requesting it, we can also tell them that people are requesting it. The next one is that we do have a dual FPSS training. So if you are a CPSS who's been certified for at least 2 years, yes, 2 years, right? Yeah, 2 years, and you're in good standing, you can take, and you have the family lived experience. So that means that you have experience as a caregiver or a parent of a youth, child, or family member that's had any sort of behavioral health challenges. So if you have that lived experience and you're a CPSS for at least 2 years, you can take that dual training. It is expedited, and so it is an 8-hour training. So it is a very shortened version because, right, if you're already a CPSS, that means that you've learned those core competencies. And so now you're kind of learning from a family perspective and to look at the family as a unit. And I think we have, when do we have our next dual training?
In September,
Yeah, so if you're interested.
I believe. I don't know.
I
I'll
think-
double check that.
Yeah, we have it coming up. And then you will also apply using that same FPSS application, and you'll see that there's a button that says you want the dual and not the core FPSS. So there is a youth peer support training. It lives in, I can't see my notes, so I can't remember the office, of rural and,
What's the new system of care? You know, Dave?
it's in my notes, but I can't, because it's,
Oh.
I don't see my notes screen, but I can't, okay, for, we'll make sure that we're getting it correctly here. It is the Office of Coordinated Care and Regional Support. So this youth training is not living with us, unfortunately, but the Coordinated Care Office, they got a grant, and so they purchased the Youth Move curriculum. So there is an option to take the youth peer support training. That's going to be in August. We did email it out to CPSSs and FPSSs, but if you want more information, please let us know. But it is going to be free. It's not yet going to be a certified training. I'm not sure if it will end up being certified with the state that is, but there is an option to take that Youth Move curriculum training in August for free. So that's, I believe, your age is 16 to 30, I think is the age range who is eligible to take that training. So if you want any more information, please find Heather and I after, and we can definitely connect you. And there are going to be more opportunities on the horizon. There's some talks that I've been in some meetings for a recovery doula training. There has been our training already hosted, and I've been meeting with some USARA folks, along with some DHHS people that we're looking at maybe hosting a specialty training with USARA for a recovery doula. I've also been talking to some people. We've had a request for an older adult peer support training. So I'm reaching out to some other states to see if there's some curriculum out there. For example, Massachusetts and New York have hosted older adult peer support trainings. So that's hopefully another future kind of specialty training. But if there are anything that you all are like, oh, we need this, or you think that this would be some topic that would be a really great specialty training, send us an email, because the with these new peer support contracts, the training agencies they have the option to host specialty trainings outside of the core curriculum. So if there is something that you're really interested in, and like an agency is willing to like host that training, and you know, but of course there's work when it comes to curriculum, but there are options to add specialty trainings. So I just want to throw that out there. So that is always an option.
Does an agency have to be a training agency in order to do specialty trainings?
Yeah, through our contract process, yeah, it has to be with on that approved vendor list. So, yes, that's the only thing. But if you have good relations, which I know you do. Okay, so we're definitely coming to the end, so we'll have plenty of time for questions. If anyone has any questions, but I just want to like throw this out there as a reminder that we do have some monthly peer calls. And you can earn 1 CEU if you come to these peer calls. It's a variety of topics. The family peer support one has an agenda that's posted on our website, and we usually have some really cool speakers. I'm definitely a little biased because I helped Leah create that agenda. And there also is the certified peer support specialist one. But you will also find this information on our website. Yes, go ahead.
So I just also wanted to add that some of the past recordings from those calls are also posted on our website. So if you can't join that day, there's recordings. So then you can also get your CEU credit that way.
Yep, so you can find the link on our website. It's under this continuing education. And so you'll see, you know, for example, you can view the FPSS agenda that's coming up. Oh, it hasn't been updated. Never mind, it's the old one. But either way, you can see the cool ones that we did in the past of maternal mental health and crisis intervention. But we do have a new agenda, it just hasn't been uploaded, so I'll get on that. But yeah, so this is where you can find the links to join, things like that. So
Amy, I was just gonna say that peer learning call,
oh, which one?
go down, or the peer learning session.
Oh,
That
there.
one right there, that wasn't on your slide, but that's our Wednesday call, the
Yes.
third Wednesday call in the afternoon, and we do it for all peers. I mean, so, like, we wanna bring the CPSS and the FPSS together, so that's another one that you can join and get an hour of CEU credit as well.
Yeah, thank you, Alicia. I
Uh-huh.
totally did forget that.
It's okay.
But this is why we go to the website. And speaking of that too, if you're a CPSS and you can't make those Thursdays, you're welcome to come to the FPSS. You don't have to, like, we welcome everyone. So if you can't make one but you can make the other, and you're welcome to go to whichever learning call you can go to, because every topic is going to be applicable to the different jobs. Yeah. So the last slide here then is just some frequently asked questions. This is what I could come up with at the top of my head when I was making this, of what we typically kind of get questions in our email about. So one is the wait list, especially for CPSS. So we do get a lot of applications. We probably get 10 a day.
Sometimes we get up to 50.
Sometimes we get more. So we get a lot of applications.
Crazy.
So we do have a wait list. It does take approximately 4 to 6 months to get into a training from the data to apply. So right, we talk about that training calendar. If you see a training coming up like in 2 weeks and you apply, you're not gonna get into that. That's just the cold truth of that. So it does take a little while. We do give preference to people who are newly hired. So I know that can be a frustrating process. But there are, like, we try our best, and we're trying different things all the time, but I know it's a very frustrating process, but like I said, we do just get a lot of applications, and we just don't have enough training that happen. And some agencies, such as USARA, can only host like 15 people, so it ends up getting like to be a really small group of people, and most agencies host around 4 trainings a year. So it can be a really frustrating process, so I totally recognize that, and we're trying to make it as smooth and as easy as possible. With the application process, of course it's going to be changing a little bit with the online application system, but essentially what has happened in the past is that you'll email or snail mail your paper application. We end up recording it on a spreadsheet, and you basically enter a queue, and then when we have a new training or like hosting a training, such as like let's say USU is hosting a training, they let us know, and then we coordinate with them and we end up sending them applications. They are the ones that actually call people, and they're the ones that vet. That's a responsibility that we put on the trainers to call people and vet applications, and then they tell us whether people can attend or not. And so that's how we end up filling an training. So moving forward is going to be very similar, where we will have all the applications online, and so we'll be able to go in and run a report on the applications that we've received, and then we will organize that by preferred training agency. And then we're going to be moving everything to online, so everything's going to be going into like a Google Drive. So we'll be sending just like a Google Drive of applications to the trainers. But that's essentially how the application process works. Once people attend the training, then the trainers send us a spreadsheet of those who passed, and then that's when Carmen, you saw her on the slide at the beginning, Carmen goes through and creates certificates and emails the certificates to people. So that's typically been the process, and that's what's going to be moving forward.
So Amy, can I ask a question?
Yes.
Just at our wellness day, I was talking to a few peers who had applied, but then they were hired in the process, so they hadn't, like, what's the process that you want us to tell peers? Like, if they apply to go through the training, but then they're hired in an agency, like, should they send an email or make a call, say, hey, I've been hired, I need this certification sooner than waiting my 6 months? Or, like, the other frustration I was hearing is that once they hit that 6 month, they're told that they have to reapply. And that was a big frustration with the peers. So is that something that's still going to happen? Is at that 6 month mark, they still have to reapply, or?
So when it comes to if they've been hired, have a supervisor email us. If they were hired by a local mental health authority, it's a little bit easier because they host trainings. So then that's the easiest process, and that's mostly what I'm talking about. When you have new hires that we give preference is that the local mental health authorities are also approved trainers. They don't have to go through the approved vendor list because they're local mental health authorities, so it's a different process. But yeah, so anyone's been hired by like Davis Behavioral Health, by Southwest Behavioral Health, if they have newly hired a peer, they do have first preference to get into training, but have a supervisor email us if they were hired. We can try our best. There's no guarantee they get into a training like earlier than anyone else, but yeah, we'll try our best. When it comes to the application, so there is a 6 month mark. However, if you have not been offered a training, we're not going to ask you to reapply. However, if you've been offered a spot in a training and you either denied it or didn't attend or something, then you will be asked to reapply because you were offered a spot. And I know that sounds really harsh, but like I said, we have a really long wait list, so we understand that life happens, but if you signed up for a training and then were a no-show, you're gonna have to reapply after 6 months. But if you weren't offered a training, that's on us. So we're not gonna ask you to reapply after 6 months. Does that make sense? Okay. Resources for CEUs. I would email USU for that, or go onto UPN's website. And so there's definitely a lot of places that you can get resources. I also have USU's list, so I could also email that out. But we have some really great community partners that have resources for CEUs. UPN's website has a calendar. They have a whole list of different webinars that are coming up. There's also the technical transfer centers, so it's like mental health, so it's MHTTC or ATTC, so it's Mental Health Technical Transfer Center or Addiction Technical Transfer Center. They have a lot of free online webinars, and a lot of them are live, and they will give you a certificate after for attendance. So those are really great free ways to find webinars and different CEU resources, but definitely reach out to training agencies and stuff, because they will have a lot of resources for CEUs. I feel like next available training, I kind of went through that already. And then the how to apply, like I said, we do have those new documents that I've uploaded to the website. Yeah, are there any other kind of questions? Well, actually, go to the next slide. Yeah, so this is the end, and we have plenty of time. Actually, we have 10 minutes, so never mind. But yeah, so any questions that you have? Great, I answered them all.
I have a question, but it's kind of different maybe. But my name is Carolina Barra. I'm executive director of the Parents for Children, and we are planning to implement the peer support in our organization. So we are trying to navigate in this team, and I don't know. I just I just got my certification last month, but I'm trying to know more about how one organization can implement this program. So,
Yeah, I think, I mean, that's definitely a hard question to answer. I would say send me an email.
oh yeah, I sent you an email.
Yeah, and I'll schedule a meeting with myself, my supervisor Leah, and then maybe Heather as well.
Okay.
And we can definitely talk with you about that. Because we do meet with different organizations that have the same exact question as you of like, how do we start this? Because there's a lot to think about with it. You know, such as like job descriptions, such as like what's our policies, supervision. There's a lot of aspects to it when it comes to implementing peer support for the first time. So let's definitely schedule a meeting so we can talk more in depth about that.
Okay,
Yeah.
thank you so much.
Any other questions?
There was talk at one time about having an advanced certified peer support specialist designation. Is anything with that?
Yeah, I mean, I've been talking about this since I started working in peer support in Utah 4 years ago. Do you have anything to
Just that it's something that we're talking about and working on, but nothing
Yeah.
yet,
Yeah, like I said, I've been talking about this for 4 years since I've been here, started working. But yeah, so there's nothing yet, but we're still in the process of like trying to just figure out what that means and like how many hours, so I don't have any firm answers for you, unfortunately.
And also to implement that, we would have to put some, something in code and rule in order to enforce it, and so sometimes that takes a while too, so.
Yeah, it's government,
Yeah.
everything's very slow, and there's a lot of red tape, yeah.
Same be true for doing anything around the supervision certification. So like, I'm sure you all saw CMS just released their new recommendation for supervision, that peers can supervise peers, right?
Yeah.
So obviously, I know that's gonna be a long-term goal if Utah does that, but would the process be the same, would be putting it in code, you know, that?
Well, I think that would be more related to Medicaid though, right? Because we're talking more about that requirement for supervision. So, do you have any answers for that?
Yeah.
Yeah.
That would require change to the Medicaid state plan, so I mean, it's doable. We'd have to have CMS sign on it, but if I haven't seen the new guidance from them, but if it's from them, obviously it's something they probably approve. I mean, oftentimes they're left hand, not talking to the right hand,
Yeah.
or right hand to the left hand, but so this is the first I've heard of it, but.
Yeah, it's great. I mean, there are other states that already have that in place where, you know, peers can supervise peers along with additional training. In my mind, that would be a supervision certification or a specialty training, maybe.
So yeah, if it's a specialty training, then I don't think we'd have to have it in code or rule, but if it is a certification, then we'd have to like define it and so that's my understanding of that process. But if you have any more specific Medicaid questions.
Well, I was just gonna ask, with the Medicaid, it doesn't matter, like, if you have a peer supervising another peer, as long as they're overseen by a clinical director, and that clinical director is giving them supervision on a consistent basis, isn't that where the supervision for Medicaid falls in?
So you're talking about if there's a licensed supervisor that's supervising a peer support specialist that's supervising a peer support specialist.
Right, so it's more like, I guess it wouldn't necessarily be like supervision, but it would kind of be like a coaching supervisor. So like, because they hired me to be a supervisor, right? And but I'm not clinical, and so we met. They had a clinical supervisor who met with us and talked over cases, had that clinical supervision over us, but I was still the supervisor and coach for the peers because I had that lived experience. And so, but they met the Medicaid requirement by having that clinical supervisor oversee the work that we were doing. So, I don't know.
I'm not as familiar with, I'm familiar with the Medicaid, but I don't know like that nitty details of it. Like my understanding was that it had to be a clinical supervisor over the peer support specialist that is billing Medicaid. But maybe there is a loophole that you can have as long as there's clinical supervision, but I don't know enough to be able to like say what
I think we need like a Medicaid, like.
We do.
like training
Yeah,
type thing in
okay.
the peer world,
Okay,
like
we're gonna work on
one of
that.
these.
Yeah.
So just my personal.
Okay. That's, yeah, because like I'm not an expert on Medicaid, so like it's hard to answer these kind of questions. Yeah.
David, so.
So for the fall substitute conference, we are doing a Medicaid 101 training. I'm working on that presentation right now. I haven't gotten to the part by when we look at doing a peers. I don't know if we get that nitty gritty just for peers because there's so many different behavioral providers that we have to look at. But maybe something similar for this conference in the future.
The peers are so
Next year,
important.
start working on
Yeah.
that right now for next year.
Mark your calendars for next year, June. Yeah. But yeah, no, that is a really good thought to maybe do like one of the learning calls and then try to get a presenter for next year's conference. Yeah, because everyone always has questions about Medicaid 'cause it's complicated. So.
Right, especially when it comes to the peer world, having
Yeah.
somebody supervise the peers
Yeah.
who has that lived experience that relates, but then we still need to be able to bill Medicaid, and so how do we do that? But anyway,
Okay. Yeah.
since you're with the state and support the peers, can you work on that for us?
You got it, Alicia. All right. Anything else? All right. Yeah. Well, if you have any questions, don't say get a hold of me.